Hello everyone. Melissa, the IVF acupuncturist here. Today, I want to talk about acai berry supplementation and how it can improve your egg quality. So, CCRM, which is Colorado Center for Reproductive Medicine, did a study a few years ago, I think, about acai supplementation after one failed IVF cycle. And so, I just wanted to go over that study today. If you don't know me, I'm Melissa. I'm an acupuncturist and fertility coach in San Antonio, Texas. I have over a decade of experience working with women going through fertility treatments. Yeah, I have an online course that's called the IVF Acupressure Academy. So you can activate your fertility acupuncture points from the comfort of your couch. It's designed for women who don't have access to someone like me, a fertility acupuncturist who specializes in IVF, or who don't, you don't have the time, you don't have the money, you hate needles, and so all these things are preventing you from getting IVF acupuncture treatments, and so you can do them from your home. There's a male protocol in the course. There's an IVF stimulation for when you're doing your IVF injections protocol. There's a protocol for the day of transfer, so right before and right after. You can do those protocols, and then there's a 2-week wait protocol. So if you're interested in that, you can go to ivf-acupressure.com, and you can sign up for my email list. I have a whole bunch of just lovely information. And then if you want to hit like and subscribe to my YouTube channel, that would be awesome too. I like to talk about things that my patients come in asking questions about, and lots of it is about supplementation because I really do believe that supplementation for both men and women can really help improve your outcomes in an IVF cycle. So let's look at this study. And this is none of this is medical advice. I'm just a person on the internet. So I always consult your doctor before starting any supplement or diet or anything like that before you're starting anything excess. So okay, here's the study. So they looked at 42 women who had gone through at least one IVF cycle and one failed IVF cycle. Their median age was 37, which I thought was really interesting because 37 is an older ovary. We're not old, but our ovaries do age quickly, and so they are looking at patients with older ovaries, which I thought was great. And so what they did was after their failed IVF cycle, they supplemented with acai berry, a high dose, so 1,800 milligrams. So they did 600 milligrams 3 times a day, and they supplemented for 8 to 12 weeks, which is an important thing. I think everybody needs to start. I'll talk about the timeline here in a second, but so the outcome was 81% of them achieved a clinical pregnancy, and this wasn't just like a positive beta, positive pregnancy test. This wasn't just a positive 6-week ultrasound. This was an ongoing clinical pregnancy, and so 81% is phenomenal. The median age for a 37-year-old is 37%, 38%. So 81 is amazing. They looked at the number of eggs retrieved in the previous failed IVF cycle and then the subsequent positive IVF cycle. And you can see right here, the failed cycle, an average of 15.8 retrieved with 8.1 eggs fertilized, average of 8.1 fertilized. And then they looked at the results after 3 months of supplementation. And look at this, it's 20 eggs retrieved, 20.6 eggs retrieved, with 11.5 fertilized, which is they say it's a significant difference, which it's wonderful. So the importance of the 3 months of supplementation is because the primordial follicle to ovulatory follicle stage is about 90 days. So that cohort that when they took their first acai pill, they were looking at the cohort that's going to ovulate in 3 months. And so really, with any sort of supplement regimen that you're going to implement for your IVF cycle, you should really start doing that 3 months in advance. Acupuncture, if you are incorporating acupuncture with your IVF cycle, preferably 3 months in advance. You can do your acupressure from your couch every single day for 3 months, and that will only help your cause. And so, really they're looking at the health of the egg, the quality of the eggs 3 months down the line. So, very interesting study. And I wanted to talk a little bit about antioxidants and, and how we get them. Of course, we get antioxidants through food. And so all of our vitamins, vitamin A, vitamin C, vitamin E, are super important antioxidants that are really DNA protective. They protect the DNA against free radicals, which is, anything from the, environmental stressors, our stress, any, crap that we're putting in our bodies, chemicals, all that stuff. So they really protect the DNA against these free radicals. And so also you look at like beta carotene. So we really want to eat the rainbow, any carrots, any like red bell peppers, tomatoes, oranges, any of like the bright orange, bright red, purple fruits, purple veg, are all really, really good to intake during your, leading into for your fertility, but definitely leading into your IVF cycle. Really, you should try and get 7 to 8 servings of fruits and vegetables in a day, 2 to 3 servings per meal plus some snacks, and just high quality, preferably organic, fruits and veg. Also nuts. There's also nuts and eggs and a little bit of dairy and some legumes in here as well. So, but the acai packets you can do, the study was with acai pills, which I think Pure Encapsulations makes an acai pill supplement that I think is 600 milligrams. The Trader Joe's has the acai packets, so if you live close to a Trader Joe's, you can get the acai packets and either make acai bowls or put them in your smoothies. But anything like pomegranates, goji berries, any of those like really beautiful hardy berries are just really good antioxidants to incorporate in your diet. If you want to do a pill, great. CoQ10 is like the baseline. It's in my basic protocol for IVF supplementation. I think everybody needs to be on CoQ10 if you're having fertility problems, both men and women. I don't care if his semen analysis is stellar. CoQ10 is very important. As ubiquinol preferably, N-acetylcysteine and glutathione. So glutathione is our master antioxidant in our bodies. It's it's the leading antioxidant to protect our cells. Glutathione is super unstable in pill form. You can get glutathione injections, but they're a little costly. And so N-acetylcysteine is the precursor to glutathione that you can take in pill form. So N-acetylcysteine is probably my number 2 supplement. I take it. It's an anti-ager. All of these are anti-agers. And then vitamin C and E. Hopefully you're taking a high quality prenatal like Thorne. Thorne is my brand of choice. They make a beautiful prenatal, super high quality, very researched prenatal. It's got great levels of vitamin C, vitamin E, and zinc in it. Zinc is another antioxidant. And then the next 5 are kind of superfluous, I would say. If you're going to throw the kitchen sink at things, then these are really good options. Alpha lipoic acid, L-carnitine, which is often recommended for men with semen with lower semen analyses, but also really, really good for egg quality. All of these have really good studies for egg quality. Resveratrol is the antioxidant in grape skins, so super high concentrated. Thorne makes a product called Resveracel, and that's a really good product for getting resveratrol in it. It's also got, I think, NR in it, which is like the true Niagen, and so, which is a kind of a leading anti-aging supplement that's out there. So, and then PQQ, also just an auxiliary antioxidant that you can add in. And so, in conclusion, I would say yes. Acai supplements can totally help your egg quality. Antioxidants are designed to help your egg quality. So definitely just get your antioxidants in. Take your acai. Take all of your all of your antioxidants in pill form and in dietary form. And I hope this video helps. Happy egg quality, and I will see you in the next video. Bye.